Hello, my name is Lisa Franklin and I'm a specialist speech and language therapist here at Integrated Treatment Services. And this video is to talk to you today about stroke and to give you some information around aphasia. Firstly, let's talk about what a stroke is. So a stroke is caused when the blood supply to part of the brain is reduced suddenly, and this is usually caused because of two reasons. One, you could have a blockage in the brain, or two, there has been a leak within the brain. So if we talk about the blockages first, basically you can get two types of blockages. You can get a thrombus, and that basically just means that when you've got a blood vessel, the clot builds over time and then the blood supply can't get through because the clot's blocking it. Or you can have an embolus, and that's basically when a small clot has travelled through your body. You know, it may have come from your heart. A small clot has broken off, has travelled through your body, and if it's trying to go through a blood vessel in the brain, which may be too small, it gets stuck, which then stops the blood supply from going to that part of the brain. Another way that you can have a stroke is obviously because of leaking. So the first thing that we need to talk about is an aneurysm. So an aneurysm is basically if you've got a blood vessel, to say you've got a blood vessel, that part of that vessel is weak. So it's likely to rupture at some point. If an aneurysm does rupture, then obviously that means that you will be having a hemorrhage. So that's called a brain hemorrhage, and that means that the blood is leaking into the brain. Depending on where the stroke occurs within your brain, it can leave a number of impairments. Some of the impairments that we might see following a stroke might be some visual impairments, impairments of other senses, including difficulties with smelling, difficulties hearing, and some difficulties with tasting. So some people lose their ability to taste sweet food or spicy food, and they lose or those taste buds are desensitized following a stroke. What we are concerned most about as speech and language therapists is that there may be an impairment to the left side of the brain where the language centres are located. So if there's an impairment or any kind of brain tissue damage on the left side of the brain within the language centres, then that might cause aphasia. Aphasia can present itself in a number of different ways. It may affect your ability to understand spoken language, it might affect your ability to talk and communicate with others, it might affect your reading and writing skills, and it may affect your ability to work with numbers. Depending on where in the brain has been impaired, that will give a different presentation for that person with aphasia. So not everyone with aphasia is the same. They actually present very differently. Aphasia may affect your ability to talk and communicate with others. It may affect your ability to understand language. That might be from simple commands through to complex language. It can affect your ability to work with numbers, to read words, or to read long pieces of text, and it might affect your ability to write, including typing up emails or writing text messages. So it can have quite a significant effect on people's lives, in their personal and professional lives. Aphasia is very varied, so one person with aphasia might present very differently to another person with aphasia. So we would look to carry out quite a detailed assessment to find out what areas and what part of the language centre is breaking down, how is it affecting their understanding or communication, and how can we help to support them through the therapeutic process so that they improve on their communication and understanding skills. Some people with aphasia are affected very severely and may have a global aphasia, which means that they have difficulties in all aspects of language. So that can be understanding language, using language to communicate, so talking. It might be reading and writing. So they would have deficits in all of those areas. For other clients, they might have difficulties with one specific area. I'm really going to talk about kind of non-fluent aphasias. So people who aren't very fluent when they talk, they might have a few words at a time. They might find it difficult to find words. They might use a lot of fillers, so and they can't get that word out. So typically have a lot of difficulties in communicating with people. So that's what we call non-fluent aphasic. And difficulties that they usually show are problems with word retrieval. So that is often a major problem in people who've got aphasia. So basically in your brain you've got a word store. All of our words are stored there, and our brain stores our words like in categories. So if we've got animals, it will be in an animal category. If I asked you to list everything with transport, it would be in that filing cabinet in your brain. But what happens when someone's trying to retrieve the word is they have to go into their store, and they have to go into the right cabinet, and they have to go into the right folder and retrieve that word. And what sometimes happens is that cabinet's just stuck, so they can't get that word. It might be that they retrieve a word from the right folder, but that it's not the right word. So instead of retrieving cat, they might retrieve a cow, because it's both in the animals folder stored within your brain. What can happen is that after a stroke and with your aphasia, that the folders are just all muddled up in your brain, and you find it very difficult to sort through it and to find the word that you need. What people with non-fluent aphasia tend to do is they might talk around a word. So it's got wheels. So they know what the word is. It's a very tip of the tongue. They know what it is. They can picture it in their mind, but they just can't find the word. And encouraging that behaviour is very important. So encouraging them to talk around it so that you can get as much context so that you can help them retrieve that word. Some people get stuck on the same word, so that's called perseveration. So when they keep saying the same word that they've retrieved recently, so they might now want to tell you that they want tea with milk, and they'll say tea with tea. And then they might try and retrieve the word milk again, and they might say tea. So their brain is sticking onto the word that they've recently retrieved. Aphasia is often considered a hidden disability because it's not physically obvious that someone may have aphasia or difficulties with their language and communication. So as speech and language therapists, we look to support our clients who have aphasia and to support their families and carers to be the best communication partners that they can be. Key tips that we would give to communication partners is, to be very patient and to always kind of guess and finish people's sentences, but help them to find and retrieve the word themselves. So you can do this by helping with a run-in. So that might be if they're trying to find the word down, you might say up and down so that they retrieve that word. There are different types of cueing strategies. So if they're trying to find a specific word, you might want to give them a cue. So if they're trying to talk about their cat, you might say what the cat's name is, or you might say it's got whiskers and it's got 4 legs, it's an animal, it's furry. So that they can find that word. And that's called a semantic cue, that you're giving meaning to the word so that they can retrieve it. Another cue that you can use is called a phonemic cue, and that's basically by giving them the first sound. So if they're trying to retrieve the word book, then you might say it's a book, and so they can finish the word saying book. And it obviously helps them to be retrieving the word and helps them to be practicing that skill. for people who have difficulties understanding language, ways that you can help support is by really keeping your language short and simple and following the speech and language therapist's advice in terms of how many words you should be saying at a time, what kind of way you should structure your sentences. For people who've got quite severe aphasia, who have difficulties expressing themselves, making sure that you've got a really good consistent yes or no systems so that you can really help clarify and confirm what their choices are. It can be very difficult for people with aphasia when they have lost their independence and lost their ability to communicate. There's lots of information available for people who have aphasia and carers of people who have aphasia. You can check the website. Please have a look out for our up and coming resources. There'll obviously be more videos around specific cueing strategies and different kind of techniques you can use to help someone with different types of aphasia and practical ideas. But in the meantime, if you're looking for information and advice, do have a look at some fantastic charities out there that do wonderful work with people with aphasia. A handful are the Stroke Association, the Connect, Speakability, and Phasic. So they'll have lots of information and guidance for you. If you need any advice from any of our speech and language therapists, just give us a call and we'll be happy to help you. Thank you for listening.